I want to take a moment to appreciate the people who work in those labs. You know, we've been rightfully talking about our healthcare heroes, our doctors, our nurses, all the healthcare workers, our first responders, our essential workers, the folks in the grocery stores and supermarkets and pharmacies, all the people out there doing such important work. But let's talk about the people who actually help us know if someone has this disease or not, the lab techs. Let's talk about them. All the people who work in the labs, we depend on them, and they are unsung heroes too. And I want to thank everyone, of course, who works in the private labs, because we're depending on them. But I want to highlight those who work in our public labs. And I want to say, give credit where credit is due. I was on Friday evening, you know, of course, the 7 p.m. clapping for all the healthcare heroes. I went to Interfaith Hospital in Brooklyn, a wonderful institution. Earlier in this decade, a lot of us in Brooklyn fought to protect Interfaith Hospital from closing. Thank God we all did work with the community, and the community stood up strong to protect Interfaith. And Interfaith's been front and center in this crisis. I talked to some of the folks that work at Interfaith, some of whom I knew from that first fight to keep it open. And we were talking about everything that had happened there. And a couple of people from the lab came forward and they said, hey, don't forget about us. Don't forget about the lab workers. So to all the lab workers, first of all, in all the 56 hospitals of New York City that have been a part of this fight, all the lab workers in all the private labs, all of you are also heroes in this effort. I want to express my deep thanks to all of you, but I want to especially thank those who've worked in our public labs. So first of all, at the New York City Department of Health, the Public Health Lab, you've heard more and more about it. It's been a crucial part of this equation. More than 200 staff work there, and for the last 2 months, they have literally been working 24/7. It's been a big part of how we fight back to have the Public Health Lab, nonstop getting results for New Yorkers who need them. I want to thank Dr. Jennifer Rakeman, the Assistant Commissioner, Department of Health, and the Director of the lab and her entire team. Job well done. And at Health and Hospitals, our public hospital and clinic system, more than 1,000 lab professionals have been in the forefront. Our public hospitals have been the front line of this crisis. I want to thank the technologists, the technicians, the pathologists, everyone who's part of those H&H labs. You've been amazing. You've worked nonstop. You've been strong and focused, and it's helped us to make the progress we've made with this disease so far. Special thanks to Kenra Ford, the Senior Assistant Vice President of Lab Services, and her entire team. Thank you so much.